What are the right and left lobes of the thyroid gland? Have you ever wondered about the structure of the thyroid gland and its lobes? The right and left lobes of the thyroid gland are the two main, wing-shaped portions of this butterfly-shaped endocrine organ. Located in the front lower neck, they sit just below the larynx or voice box and are positioned anterior to the trachea, which is commonly known as the windpipe. These lobes are connected in the middle by a thin band of tissue called the isthmus, which lies over the second to fourth tracheal rings. Each lobe measures approximately 4 to 6 centimeters in length and has two distinct poles. The superior pole is narrower, while the inferior pole is broader, giving the lobes a somewhat pear-like shape. They extend vertically along the sides of the trachea, reaching from the level of the thyroid cartilage down to the fourth or fifth tracheal cartilage. The lobes are nestled within the muscular and carotid triangles of the neck, containing important anatomical landmarks such as the Zucker-Candle tubercle. This pyramidal extension near the back of each lobe is significant in thyroid surgery due to its proximity to the recurrent laryngeal nerve. Medially, the lobes are closely related to the larynx, trachea, and muscles like the cricothyroid and inferior pharyngeal constrictors. The parathyroid glands, which play a role in regulating calcium metabolism, are usually found embedded on the posterior surfaces of both lobes. Blood supply to the lobes comes from the superior and inferior thyroid arteries. Additionally, important nerves such as the external and recurrent laryngeal nerves lie near these lobes, making their preservation critical during thyroid surgery. Understanding the anatomy of the right and left lobes is essential when discussing thyroid disorders. Many thyroid diseases, such as nodules, goiters, thyroiditis, and cancers, can affect one or both lobes. Surgical procedures often target one lobe, known as lobectomy, or both lobes, referred to as total thyroidectomy, depending on the extent of the disease. The anatomical variations in lobe size, shape, and symmetry can significantly influence diagnosis and treatment planning. In summary, the right and left lobes of the thyroid gland are crucial components of this important endocrine organ. They play a vital role in hormone production and are closely associated with essential neck structures relevant to thyroid health and disease management. Understanding their anatomy helps in recognizing the complexities of thyroid disorders and the necessary medical interventions. Always consult a healthcare professional for personalized advice regarding thyroid health.